What happens to your body and mind? When you masturbate, a urologist's scientific perspective. Before we dive in, did you know that almost everyone masturbates at some point in their lives, yet the topic remains taboo across most cultures? Do you wonder if masturbation really affects your health, physically, mentally, or sexually? Stay tuned because today we'll uncover surprising truths that might challenge what you've heard. If you find this topic interesting, please hit the like button, share this video with friends who might benefit, and subscribe for more deep dives into sexual health. Don't forget to leave a comment below with your thoughts or experiences about masturbation. Introduction. Is masturbation really a problem or a natural part of human sexuality? Masturbation is one of the oldest and most universal human behaviors, yet it is shrouded in myths, misinformation, and cultural taboos. As a practicing urologist with years of clinical experience and specialization in sexual medicine, I frequently encounter patients and people curious about masturbation, and their concerns range widely. Some ask, does masturbation cause erectile dysfunction, or can it damage the penis? Others worry it causes premature ejaculation or affects fertility. Before answering these questions, it's crucial to understand the natural history of human sexual development. Masturbation is not some recent phenomenon or unnatural act. It is a deeply embedded part of human biology and development. 1. Sexual development and masturbation. From womb to adulthood. Contrary to popular belief, sexual activity does not start at puberty. It begins far earlier. Scientific studies show that male fetuses experience erections inside the womb as early as 26 weeks gestation. This indicates that physiological sexual function is active before birth. From infancy to early childhood, around 2 years old, children naturally explore their bodies, including their genitals, as a normal part of development. Around age 6, children typically learn social boundaries and cultural norms, understanding that touching their genitals in public is generally considered inappropriate. At this stage, children also begin internalizing gender roles and begin to absorb cultural narratives about romance and relationships, often idealized fairy tales about princes and princesses. Timeline: 26 weeks gestation, first evidence of erections. Age 2, early genital exploration begins. Age 6, social norms around touching are learned. Puberty, approximately 12 to 14 years. Onset of masturbation typically begins. Masturbation commonly begins during puberty, the natural developmental stage where hormonal changes lead to sexual awakening and interest. In open societies with fewer restrictions, masturbation is often seen as a normal and healthy part of this developmental process. 2. Does masturbation cause erectile dysfunction or premature ejaculation? One of the most frequent questions I hear is whether masturbation leads to erectile dysfunction, ED, or premature ejaculation, PE. The straightforward answer based on medical evidence is no. Scientific evidence. Erectile dysfunction is primarily caused by vascular, neurological, psychological, or hormonal issues. Masturbation does not damage penile tissue or vascular function. On the contrary, regular erections, whether during sleep or masturbation, help maintain penile health by oxygenating tissues. This phenomenon is called penile maintenance. A 2016 study published in the Journal of Sexual Medicine concluded that masturbation does not cause premature ejaculation. Rather, PE is often related to neurochemical imbalances or psychological factors. In fact, masturbation can serve as a healthy outlet to understand one's sexual responses and improve control over ejaculation timing. 3. Physical and mental health benefits of masturbation. Surprisingly to many, masturbation is associated with multiple health benefits, endorphin release and mental well-being. Masturbation triggers the release of endorphins, the body's natural feel-good chemicals, which improve mood and reduce stress. The Queensland Health Authority in Australia launched a campaign in 2021 titled "Give Yourself a Hand: The Health Benefits of Masturbation," highlighting these benefits. Reduction of menstrual cramps, improved sleep quality, enhanced relaxation and stress reduction, promotion of positive body image, Prostate health, regular ejaculation, including through masturbation, has been linked with a reduced risk of prostate cancer. A landmark 2016 study in European urology found that men who ejaculated 21 or more times per month had a significantly lower risk of developing prostate cancer compared to those who ejaculated 4 to 7 times per month. While more research is needed, this is promising evidence for the protective role of masturbation. Penile health and function. Penile erections increase blood flow and oxygen delivery, essential for maintaining healthy penile tissue. This is why nocturnal erections occur naturally, even without sexual stimuli, to exercise the penis. Masturbation contributes to this maintenance by regularly promoting erections. 4. Cultural and religious contexts. Why masturbation is taboo. Despite its biological normalcy and health benefits, masturbation is often viewed negatively due to cultural, religious, and historical factors. The role of belief systems. In many religions, masturbation is considered sinful or immoral, creating psychological conflict and guilt among adherents. This psychological burden can lead to distress or even mental health issues. To illustrate this point, laws and norms vary globally, just like speed limits for cars differ between countries. For example, in the US, the maximum highway speed limit is typically 65 to 80 miles per hour. Exceeding it is illegal and punishable. In Germany, on certain stretches of the Autobahn, there is no speed limit, allowing drivers to go as fast as they safely can. Similarly, what is forbidden or sinful depends largely on context and cultural rules. If you believe masturbation is wrong, that belief alone can make the act psychologically stressful, which may lead to genuine health consequences related to guilt, shame, or anxiety. 5. When can masturbation become a problem? While masturbation is natural and mostly harmless, excessive or compulsive masturbation may signal underlying issues, such as psychological distress or anxiety, underlying obsessive-compulsive tendencies, avoidance of social or intimate relationships. In these cases, the problem is not masturbation itself, but its role as a coping mechanism. Professional help such as psychotherapy or counseling can be beneficial. 6. Masturbation. Within relationships, is it cheating? Many people avoid masturbation in committed relationships, fearing it is a form of betrayal. However, modern research shows that masturbation within relationships can be healthy and does not necessarily indicate dissatisfaction. Practical example. Studies on couples have found that partners who openly communicate about masturbation and sexual needs tend to have higher sexual satisfaction and relationship quality. Masturbation can be a personal form of sexual expression and stress relief that complements rather than detracts from partnered sex. Conclusion. Masturbation is a natural, healthy, and context-dependent behavior. Final, thought-provoking question. What happens to your body and mind if you continue to embrace masturbation as a natural part of life, free from guilt and misinformation? The medical evidence strongly supports masturbation as a safe, normal, and beneficial activity. It plays a vital role in sexual health, mental well-being, and even long-term physical health, such as prostate protection. However, cultural and religious beliefs deeply shape how individuals perceive masturbation, which can influence their psychological response. If you experience guilt or anxiety about masturbation, it's important to address those feelings compassionately and seek professional advice if needed. Remember, masturbation is neither a sin nor a sickness, but a healthy human behavior. Before you go, don't forget to like this video if you learned something new. Share it with your friends or loved ones. Subscribe for more insightful health content, and comment below your personal experience or questions on this sensitive but important topic. Thank you for watching. Take care of your sexual health and well-being.